Half of the country currently has high or very high levels of respiratory illnesses. Half. That's according to the latest data from the CDC. Now, the flu appears to be contributing factors here in terms of the numbers and the illnesses. With me now to break this down, Dr. Frita Fisher. Dr. Frita, good to see you. We've discussed this. It's still here. It's still getting worse. And you have spoken to the point of the strain it's putting on hospitals.
Absolutely, Susan. Good morning. We're up to 77% of pediatric hospital beds being full, and the numbers are still rising. The CDC just reported even more elevated numbers, peaking to what we would have expected in December, but the peaks are early, and it looks like we're still headed in that direction, and so parents must be aware. RSV is here. It can make children severely ill, and it's not always easy to know when your child is ill because children tend to compensate.
And what should parents do? Because there is a sense of fear when you think about the numbers. Does the flu shot, of course, help in a situation like this? And just to be aware, knowing the signs of your child and when to go to the hospital?
Well, Susan, right now there's no vaccine for RSV, although according to Pfizer, they'll be submitting for FDA approval by the end of this year. But getting vaccinated with the flu vaccine for your children is helpful in general, as far as keeping them from getting respiratory illnesses, as well as the updated COVID-19 booster or the initial COVID-19 vaccine. Why? Because that will help to decrease their chances of getting some of these other respiratory viruses that are prevalent. But mainly adults need to know when you're looking at your kids, if your child has flaring nostrils, bluish lips, if they're breathing with accessory muscles, like using their neck muscles to breathe, if their stomachs are going in and out, if their heads are bobbing, if they're grunting, these are signs that you have to look out for in these infants, especially who cannot speak to you, who cannot talk. So parents need to be extra vigilant. Watch your children. Don't just think it's a common cold necessarily. Get tested for RSV.
And finally, why do you think the numbers are off the charts here? Do you think it's in response to wearing the mask because of COVID for so long and maybe we weren't exposed to as much?
Absolutely, Susan. It's because of the masks for COVID. Now, again, wearing the masks during COVID-19's peak, that was the right thing to do to keep our children from getting COVID-19. But yes, it kept them from being exposed to RSV and other viruses. So now children who normally would have gotten it by the age of 2, that's when most kids get RSV. Now those kids are 3 and 4 years old. They're getting RSV, plus the children who are less than 2 are getting RSV. And what's happening is we're having some overwhelming hospitalizations early on in the season.
I got you. That makes sense. Thank you so much for giving us the tips to be alert and aware. Dr. Frita, thanks.
Thank you.